You wake up every single morning with the same quiet discipline. Before you pour your first cup of coffee, before you check the headlines, and before you greet the day, you perform a ritual that has become as fundamental to your life as breathing.
You reach for that plastic pill organizer on the kitchen counter. You open the little lid labeled AM, pour those familiar tablets into your palm, and swallow them with a glass of water.
You do this because you were told it was the right thing to do. You do it because you want to stay independent, you want to keep your heart strong, and you want to be there for your children and your grandchildren.
You trust the process. You trust the medical system. And most of all, you trust that as long as you follow the instructions on the label, you are doing everything in your power to protect your future.
But I need you to pause for a moment. I need you to ask yourself, do you really know what is happening inside your body when those pills dissolve? For many, the answer is a heartbreaking no. You know the name of the pill, you know the dosage, and you know the time of day, but there is a missing piece of the puzzle, a hidden truth that determines whether you stay safe or whether you get hurt. This missing piece is where the confusion starts, where the unnecessary fear takes root, and where the most dangerous mistakes happen. It's where people start feeling faint in the bathroom at 3 a.m. It's where they stop a life-saving medication too fast because they misunderstood a symptom. Or they ignore swollen ankles for months thinking, oh, it's just old age. I am Dr. Evelyn Hayes, and I am here because I believe that the most important medical instrument in your house isn't a stethoscope or a blood pressure cuff. It is your own informed understanding of your treatment. The reality is that for millions of seniors, the standard 15-minute doctor's appointment is simply too rushed. Details get compressed, nuances are lost, and the vital at-home guidance that keeps you safe often never reaches your ears. You are left to navigate the side effects, the drug interactions, and the changes in your own body alone. You assume that because these drugs are common, they must be simple. You assume that as long as the number on your blood pressure monitor looks acceptable, everything is fine.
That assumption that these medications are interchangeable, harmless, and straightforward is where the real danger lives. It is a silent risk that doesn't announce itself with a siren. It announces itself with a fall, a sudden hospital visit, or a decline in your quality of life that you mistakenly attribute to just getting older. But it doesn't have to be this way. Today, we are going to peel back the curtain on the 4 most common medications you might be taking: Losartan, Valsartan, Amlodipine, and Metoprolol. We are going to go beyond the clinical labels and the generic instructions. We are going to talk about the 11 secrets that your doctor simply hasn't had the time to explain to you. By the end of this video, you won't just be taking a pill because you were told to. You will understand the purpose behind that pill. You will understand the family of your medication, the specific job it does, and exactly what you need to look out for. We are moving from blind obedience to informed, empowered safety. Your heart, your kidneys, and your independence are worth far more than a 30-second explanation in a busy clinic. If you are ready to stop being a stranger to your own treatment, then stay with me. It's time to find out what those pills are actually doing and how you can take control of your health with clarity and confidence. Let's get started.
One of the most dangerous assumptions we see in our clinics is the belief that all blood pressure pills are created equal. You've likely heard it before. Oh, it's just another blood pressure med. If you have a friend who takes Losartan and you take Amlodipine, it is easy to assume you are basically taking the same thing.
You might even find yourself in the pharmacy looking at the two bottles and thinking that one could easily be swapped for the other if you ran out or wanted to save money. I want you to stop that thought right now. Truth number 11 is this: these are not four versions of the same pill. Think about it like this. If you want to get to a destination, you might take a car, a train, or a plane. They all get you to the same place, right? But the experience, the route, and the requirements are completely different. Your blood pressure medications are exactly the same. They all aim to lower that number on your monitor, but they take entirely different roads to get there, and they interact with your body's unique ecosystem in ways that are deeply important. Let's look at the two big families you might be on, the ARBs and the CCBs. First, let's talk about the ARBs, which include medications like Losartan and Valsartan. These belong to a class called angiotensin II receptor blockers. Imagine your blood vessels have little locks on them. When your body senses a need to boost blood pressure, it sends out a hormone key that fits into those locks, causing your vessels to tighten or constrict. It's a natural, survival-based system. However, in many of us, that system is overactive. An ARB works by acting like a shield over those locks. It prevents the hormone key from ever reaching its destination. By keeping those vessels relaxed, it lowers your pressure, but it also does something more. It protects your kidneys and your heart from the long-term strain of that constant tightening. Now, contrast that with the CCBs, or calcium channel blockers, like Amlodipine. This is an entirely different strategy. Amlodipine doesn't focus on the hormone system. Instead, it focuses on the microscopic electrical signals that tell your blood vessel muscles to contract. By blocking calcium from entering your blood vessel muscle cells of your vessels, it prevents that contraction from happening in the first place. It's a direct physical relaxation of the vessel wall. So, why does this distinction matter for you living your daily life?
It matters because the story your doctor is telling when they prescribe these is different for each one. If you are on Losartan or Valsartan, your doctor is often looking beyond just a number. They are thinking about the health of your kidneys, your heart failure risk, or long-term vessel protection. If you are on amlodipine, they are likely looking for a strong, steady, and reliable way to keep your vessels open, often when other treatments haven't been enough. The danger arises when you stop seeing these as specific tools and start seeing them as interchangeable pills. We've seen patients like Leonard, a 72-year-old retired electrician, who told me, "Doctor, I've taken 3 different blood pressure meds over the last 10 years, and they all feel the same to me." Leonard meant well, but that way of thinking is a trap. If you don't understand the road your medicine is taking, you can misread every single symptom you feel. You might assume a side effect is a failure of the drug, when in reality, it is simply the specific, intended effect of that particular family of medication. When you treat these medications as identical, you lose the ability to advocate for yourself. You might accidentally double up on the same class of medication, taking a Losartan and a Valsartan together because you thought they were different enough, not realizing you are just flooding your system with the same mechanism, potentially pushing your kidneys and potassium levels into a danger zone.
The truth is that your prescription is not just a label, it is a targeted physiological strategy. From this day forward, I want you to look at your pill not as just another pressure pill, but as a specialized tool. Knowing whether you are on an ARB or a CCB isn't just medical trivia, it is the first step toward understanding how to keep your heart safe and your treatment effective. Never guess, never borrow from a spouse, and never assume they're the same. Understanding the family is the first step in mastering your own health. There is one side effect that sends more seniors into an absolute state of panic than perhaps any other, It is visible, it is uncomfortable, and it often leads to a cascade of anxiety that is entirely unnecessary. I'm talking about ankle swelling, and if you are taking a medication like amlodipine, I want you to listen very closely. This is truth number 9, and it is a conversation that needs to happen before you stare into your bathroom mirror and jump to the worst possible conclusions. Let's talk about Eleanor. Eleanor is 74, active, and rightfully proud of the fact that she still walks every single evening after dinner. She considers her evening walk to be her health insurance, a time to clear her head, stretch her legs, and keep her heart moving. A few months ago, her doctor increased her amlodipine dose from 5 milligrams to 10 milligrams to better manage her blood pressure. Everything seemed fine until about 2 weeks later. First, she noticed her socks were leaving deeper marks than usual. Then, her favorite walking shoes started to feel just a little bit too tight, almost like they had shrunk in the closet. By the end of the day, when she sat down to relax, she looked down and saw it. Her ankles were puffy, they were swollen, and the skin looked taut.
Like many of you, Eleanor didn't immediately think, "This is a side effect of my new dose." Instead, her mind raced to the scariest possible explanations. Is it heart failure, she wondered? Are my kidneys giving out? Is something collapsing inside my body? Instead of calling her doctor, she did what so many frightened patients do. She went into watch and worry mode. She stopped her evening walks because she felt uncertain and unstable. She sat on the couch, worried, and because she wasn't moving, the swelling actually got worse. Here is the truth that patients deserve to know from the very first day. Ankle swelling is one of the most common, well-known side effects of amlodipine, especially after a dose increase. It happens because of how the drug works. Remember what we said about amlodipine being a calcium channel blocker? It relaxes your blood vessels to lower your pressure, but in doing so, it can cause the small vessels in your lower legs to open up a bit too much, allowing fluid to leak into the tissues around your ankles. It is not, for most people, a sign that your heart is failing or that your kidneys are shutting down. It is a local effect of the medication doing exactly what it was designed to do to your blood vessels. However, I need to be very clear about a crucial nuance. Just because it is a common side effect does not mean you should ignore it. It is not an excuse to suffer in silence or to decide on your own that everything is fine. You must ask yourself, is this new? Is it getting worse? And most importantly, is it accompanied by other symptoms?
If your swelling is paired with shortness of breath, chest discomfort, rapid weight gain, or an inability to lie flat at night, that is a different story. That is when you stop waiting and you pick up the phone. But if you have stable, mild swelling that appeared right after a dose adjustment, it is a signal, not a catastrophe. The reason this side effect causes so much unnecessary suffering is that no one warns the patient. When you are told, "Take this pill, it will help your heart," you aren't prepared to see your own feet change shape 2 weeks later. The fear comes from the unknown. So what should you do? First, stop the panic. Do not let the fear of swelling stop your movement, as exercise actually helps circulation. Second, be a detective. If you notice it, track it. Write down when it happens and how it feels. Third, communicate with your provider. For many patients, a simple dose adjustment, the addition of a different type of medication, or even just timing the dose differently can make the swelling vanish entirely. The hidden truth is that amlodipine is a beautiful, effective medication for millions of people. It saves lives every day. Its most visible side effect, swelling, is often just a physical reminder of the medicine's activity in your body. Don't let a pair of puffy ankles make you a prisoner in your own home.
Understand the symptom, monitor the changes, and keep your doctor in the loop. You have the right to be comfortable, and you have the right to be informed. There is a moment in every patient's life that the label on your medicine bottle rarely prepares you for. It's not the day you feel strong, it's the day you don't. It's the day you wake up with a stomach bug or a fever, or a day where the heat is oppressive and you simply can't keep food or water down. Most of us are taught, take your medicine every single day, no matter what. It is a rule of discipline that we take pride in. But I am here to tell you that this rule, if applied blindly, can become a dangerous trap. This is truth number 6, and it is a lesson that changes everything when your normal body is no longer normal. Let me tell you about Harold. Harold is 70, a retired accountant who prides himself on his meticulous routine. He never misses a dose of his Losartan, not for travel, not for holidays, and certainly not for a common stomach bug. When he caught a 24-hour virus that left him vomiting and unable to keep liquids down, his instinct was to be the good patient. He kept taking his medication exactly as prescribed, feeling that skipping it would be a moral failing or a sign of weakness. By the second day, Harold was weak, dizzy, and terrified. When he tried to stand to go to the bathroom, the room spun. His wife, worried, checked his blood pressure, and the number was shockingly low, far lower than it had ever been. Harold thought he was having a medical emergency, and in a way, he was. But the culprit wasn't just the virus. It was the combination of his standard blood pressure medication and a body that had become dangerously dehydrated. Here is the hidden reality. Your blood pressure medication is designed to work within a specific internal environment, one where your blood volume is steady and your hydration is balanced. When you lose fluid through vomiting, diarrhea, or even extreme summer heat and sweating, your internal environment shifts, your blood volume drops. Suddenly, the very medication that was keeping you perfectly stable just a few days ago is now working too well. It is pushing your pressure down into the floor, leaving you lightheaded, prone to falls, and potentially leading to a dangerous dip in kidney function. This is what I call the sick day conversation, and it is a conversation that far too many patients have never had with their doctor. When you look at your pill bottle, it says take once daily. It does not say take once daily unless you are vomiting. But your body doesn't care about the label, it cares about the chemistry. If you cannot keep fluids down, your kidneys, which are already working hard to process your medications, are suddenly placed under immense strain. With drugs like Losartan or Valsartan, dehydration can turn a routine, protective prescription into a physiological hazard. So what should you do? First, stop viewing your medication as an absolute, unbreakable command. Start viewing it as a part of a system that must adapt to your current state. You need to call your doctor's office before you get sick. Ask them, if I ever have a day where I cannot eat or drink, what should I do with my blood pressure medicine? Every provider will have a different answer based on your specific health history. Some might tell you to skip it for 24 hours. Others might tell you to halve the dose. The answer isn't the point. The plan is the point. You need a sick day plan that is written down, clear, and understood by you and your spouse or caregiver. The hidden truth here is that consistency is a virtue, but adaptability is a safety requirement. Do not wait for the moment you are hunched over in the bathroom, dizzy and sweating, to wonder if you should take your pill. By then, it is too late to think clearly. Prepare for these moments when you are feeling healthy. Know your triggers: persistent diarrhea, high fever, or an inability to tolerate fluids. These are not minor inconveniences for a senior on blood pressure medication. They are critical events that require a change in strategy. You are the steward of your own body. Don't be a stranger to how your medication interacts with the world around you. By having the sick day conversation now, you replace panic with preparedness. When the next bug hits, you won't be guessing, and you won't be taking unnecessary risks. You will be acting on a plan that is designed to keep you and your heart safe, even on your worst days. We have covered a lot of ground today. We have talked about the families of your medications, the reality of side effects, the importance of hydration, and the hidden dangers of the do-it-yourself approach to your heart health. If you feel a little overwhelmed, I want you to take a deep breath and let that feeling pass. You don't need to become a cardiologist overnight. You don't need to memorize every chemical pathway or every interaction. What you need is something much more powerful. You need to stop being a stranger to your own treatment. For too long, the culture of medicine has been one-sided. You go to the office, you wait, you get a new prescription, and you leave with a handshake. The doctor is busy, the clock is ticking, and the nuances of your daily life, how you feel when you stand up, how your legs feel after a walk, how you handle a stomach bug, often get left in the waiting room. But remember this, you are the one living with these medications every single day. You are the one observing the subtle shifts in your energy, your balance, and your comfort. If you take only one thing away from our time together, let it be this. You have the right to ask, and you have the responsibility to know.
There is one question that is so simple, yet so profoundly transformative that it can change the entire dynamic of your medical care. The next time you sit in that chair across from your doctor, I want you to look them in the eye and ask, what exact job is this medicine doing in my body? That isn't a challenging question. It isn't a confrontational one. It is the question of an informed, empowered patient. When you ask that, you aren't just asking for a name or a dosage. You are asking for the purpose. You're asking if this pill is for your blood pressure, your heart rate, your rhythm, or your kidney protection. Once you know the why, the what becomes much easier to manage. You stop judging the medication by internet headlines and start judging it by the specific job it was chosen to perform for you. When you understand the purpose, fear loses its grip. When you know that an ankle swell might be a side effect of a calcium channel blocker, you don't panic, you communicate. When you know that your beta blocker might make your hands feel cold or your pulse slow, you don't assume you are finally getting old. You check in with your doctor to see if the dosage still matches your life. You have worked hard your entire life to build a legacy, to raise a family, and to stay active and independent. Your health is the foundation of all of that. Do not let that foundation be built on guesses, assumptions. So, I invite you to take these insights and use them. Look at your pill organizer tonight with new eyes. Be proud of the care you are taking, but be vigilant about the details. Reach out to your healthcare provider. Have those honest conversations about your symptoms and keep asking the right questions. You are the captain of this ship. With the right information, you can navigate these waters with confidence, knowing that you are doing everything in your power to protect your heart, your brain, and your future. Thank you for trusting me with your time today. Protect your heart, keep that curiosity alive, and remember, you are never just a patient. You are a person, and your health story is the most important one you will ever write. Stay safe, stay informed, and I will see you in our next conversation.